Do you feel that your booty is causing lower back pain? Well, it's not necessarily just your booty. Sometimes genetics, and especially for females, the way that your pelvis is formed, will create this increase in your sacral base angle, which will also increase the lordotic or curve in your lower back. But for most people, it's not just how you were born, it's that you have weakness and tightness in certain areas. It's called a lower cross syndrome. So historically, for many of you, if you suffer from lower back pain, achiness, digestive issues, fertility problems, anything that might happen down here as far as the nervous system and the neurology, a lot of times you can have this lower cross syndrome, which means that the core, the abs, are weak and the glutes are weak. Now, conversely, the lower back is really tight and the hip flexors are really tight. So what we want to do is flip that on its head and start to create more equality in the muscles throughout your entire core, and that's going to take pressure off of that lower back. So I have two things that we're going to show you. Number one is a treatment that we perform to help with this increased sacral base angle. And number two is something that you can do as far as your mindset goes of being aware of your posture. So when you first came in through our chiropractic evaluation, if we saw on your x-rays and your analysis that you had what's called an increased sacral base angle, for some of you, we have a very specific adjustment that we've begun to do over the last couple of years that we've had a lot of success with, especially for females. And so what that means is that, like I said, it increases that curve. And so what we utilize is the drop table. And then I put my hands on the top of the sacrum. And what we're going to do is just apply a distraction, almost like a traction of the sacrum. For a lot of you, as Dr. Megan and I are performing this adjustment, you actually tell us you can feel a release in pressure. It almost feels like you're uncorking your spine, and it's because it's been rotated in the wrong direction. And after we hold that for a bit, now we have the magic moment. We do a drop, pushing straight down towards her feet, and then we hold it for a little bit longer. What that's going to do is help to set the alignment of that sacral base. Now, the other thing that you need to do is practice on your own how to get that pelvic neutral. You want to over-exaggerate it at first and then under-exaggerate it, and then you're going to find neutral. And so on a daily basis, if you're at your home sit-stand desk, if you're squatting, if you're exercising, if you're washing the dishes, I want you to find pelvic neutral. So the first thing you do is you go forward as far as possible. Other side, other way. Oh. So forward with the pelvis, and that's going to stick the butt out. And then you want to come back as far as possible, so you're bringing your buttocks underneath you. So that's exaggerated in both directions, and then you can get that feeling, and now you want to find the middle. And when you find the middle, you should see ears over shoulders, over hip, knee, ankle. So when that hip is right over and in line with everything, that is pelvis neutral. That's what you want to be shooting for. Not everybody needs this adjustment. Dr. Megan and I know who and when. However, we've had a lot of success with it. So if we feel you need it, we're going to throw it your way, and you're probably going to feel the benefits as well. Make sure you follow us and you like this, because in our next video, we're going to give you some exercises to strengthen your core and your glutes while stretching out your lower back and your hip flexors. We'll see you next time. Do you feel that your booty is causing lower back pain? It's very common, and it's not actually about the booty. Sometimes it is just, oh, come on.
Sorry. Okay, I got this.
I don't know what you're saying.
Just, I needed 1 minute to laugh. Okay, go.
Okay. So now we gotta start all over.
Everything's burning. I'm not kidding. I have my knees locked out.